If there's no sign of a rebound, and the trajectory of COVID outbreaks is showing signs of going down, starting from April the 21st, we will be relaxing most of the social distancing measures in 3 phases over 3 months, which means most of the measures would be relaxed.
And DW correspondent Phoebe Kong is in Hong Kong and filed this report on the current situation in the city.
Over 1 million people, about 15% of Hong Kong's population, have been infected in the latest wave. The death rate here is even the highest in the world due to the low vaccination rate among elderly. The Hong Kong government has mobilized all its local and Beijing's resources to build up plenty of containment facilities. While the number of deaths remain high, we have seen a slight decline in daily infections in recent days. But as the healthcare system reaches its limit, so does public tolerance. The hardline zero COVID approach has triggered mass collapse of businesses and exodus of expatriates, prompting the authorities to change its handling after backlash. Flight ban will be lifted, citywide mass testing is put on hold, social distancing measures may be relaxed in coming weeks. Many welcome the shift and see this as a potential roadmap to normality, although the city's top leader Carrie Lam denied that Hong Kong is going to live with the virus. But for her, this is a political and economic dilemma. That Hong Kong has become the hardest hit part of China, but now it seems infeasible to adopt the Chinese way of containment here on the ground.
And joining me now for more is Professor Ben Cowling. He's Chair of Epidemiology at the School of Public Health at the University of Hong Kong. Ben, you're part of the team of epidemiologist Gabriel Leung at your university, which is suggesting that the government should consider moving away from the zero COVID policy. Is there any scientific basis to sticking to it?
Well, in the first years of the pandemic, it made a lot of sense to follow zero COVID. We're waiting for vaccine coverage to go up, and until then, we're protecting public health. Now, in Hong Kong, more than 60% of the population have been infected. We have a very high level of vaccine coverage. In elderly, it's not that high, but it's going up. I don't think there's really any need to continue with zero COVID in the medium to long term. In the very short term, we've got to be careful. We've got to buy a little bit more time for vaccine coverage to go up in the elderly. But I think it'll be really the best approach to plan an exit from the current social distancing measures, the current COVID policies.
We had Carrie Lam speaking earlier, and she was talking about a loosening of some restrictions, primarily to do with travel restrictions and also social distancing measures. Does that help in the medium term?
Well, although there's an announcement that some of these measures are going to be relaxed, the degree of relaxation at the moment is actually not that much. For example, for the travel restrictions, there's still a 7-day quarantine for arriving travelers, and only maybe 1,000 people per day can arrive into Hong Kong because of the limitations on the rooms. And airlines will still have the possibility of 14-day route bans, although they can, in theory, fly in if there's 3 or more people on a flight that test positive on arrival. That airline and that route will be banned for 14 days. So it's not a complete relaxation. And domestically, there's a timeline over the next 3 months to gradually relax one measure after another. But that's conditional on case numbers staying low. And actually, we already know that the case numbers will go up again when schools reopen and when some of the other measures are relaxed. And I'm not sure, in that sense, I'm not sure how much relaxation there will be in the next 3 months.
Talk to us a bit about those case numbers, because our correspondent was reporting that some 15% of Hong Kong's population has been infected in the current 5th wave of the pandemic. How much worse could it get?
Well, what we know is there's more than 1 million confirmed cases. That's 15%. But we know many people were infected without being confirmed. That's the same everywhere in the world. We estimate that more than 60% of the population were infected within the last 2 months. We had a lot of severe cases of COVID in the elderly who were not vaccinated. For now, actually, because of the level of immunity we have from 60% of the population infected, 80% of the population vaccinated as well, really COVID doesn't pose as much of a threat now and into the future as it had in the past. But still, as I said, the vaccine coverage in elderly is not that high. It's increasing, but it's not that high. So we still have to be a little bit careful right now at the moment.
Ben Cowling, we'll leave it there for the time being, but I suspect this is not the last conversation we'll be having about COVID in Hong Kong, unfortunately. Ben Cowling, always a pleasure talking to you. Thank you so much.
Thank you.
Hong Kong's zero-COVID policy reflects the one on the Chinese mainland. Here, local lockdowns and mass testing have been the norm. But lately, greater attention is being paid to minimizing the economic impact of these measures.
A pregnant woman infected with COVID-19 is filmed by Chinese state TV as she arrives at the hospital. She's about to have an emergency caesarean. The birth goes well, we're told. The baby boy is healthy and tests negative for COVID. But the scene shows the lengths China is going to stop the spread of the Omicron variant. All involved are wearing triple personal protective equipment. And this health expert explains how mother and baby will now be separated for at least 10 days to make sure the newborn does not catch the disease. Parts of China are seeing a surge in cases as Omicron hits the country. The uptick is small compared with the West, but Beijing is determined to eliminate the outbreak in line with its zero COVID strategy. It's carrying out mass testing, and in places such as Jilin in the northeast, is locking down millions of people for days, and sometimes weeks on end. From a global perspective, COVID-19 is still in the pandemic period, and it is still a public health emergency of global concern. The pandemic is still showing an upward trend, particularly in some countries and regions around China, and the pressure for China's prevention effort against virus inflow remains. But signs of a new narrative are also starting to emerge, as fears grow of the impact of such lockdowns. Beijing is beginning to talk about balancing the health crisis with the needs of the economy. In the southern city of Shenzhen, much was made of the return to work earlier this week and the reopening of most businesses, with talk of Beijing taking a more customized approach to closures to ensure a stable supply chain. And in Shanghai, where cases have reached an all-time high, authorities were quick to try to staunch rumours that another citywide lockdown was coming. They said neighbourhoods there would be closed and screened one by one.